So welcome everyone. Karibu for the Kenyan viewers that are listening to us. It's really a pleasure for Melanin Kapital to start with its first live event, its first online pitch. And we are very, very happy to finally disclose the entrepreneurs we've been working on for the past 3 months. Thank you for all the panelists and the speakers that joined us tonight, and welcome. We're very, very happy to be with you here today. Maybe let me start with a short introduction for those who could not be with us this Monday evening on our lunch event. This would be the possibility to at least catch up. So I am Melanin Kapital, CEO and co-founder of Melanin Kapital. Basically, just to introduce you to Melanin Kapital, what we do is to support social impact entrepreneurs to get access to resources here in Europe. And we do that by providing education, advisory, and connection to our wide network of angel investors, VC funds, venture capital funds, corporates here in Europe that are interested in expanding in the African continent. And we try to inspire collaboration so that together we can build today the Africa we want tomorrow. So today we have the pleasure to start and showcase entrepreneurs that have followed with us our investor readiness program, Tuungane. And for this, I will let Ian Minjure give you a short presentation about what we've done and who is presenting today. Thank you. Ian, you're on mute. Yes.
Thank you very much, Melanie. My name is Ian Minjure, and I'm the co-founder of Melanin Kapital. Together, for the last 3 months, we've built something called the Tuungane Program. Tuungane means let's unite in Kiswahili. It's a native language in East Africa and Kenya, where I come from. Today, we're going to show you what happened in the last 3 months as we brought entrepreneurs from Africa and Europe together. We did a call for proposal and we did a rigorous process where we selected 10 entrepreneurs, 5 from Africa, 5 from Europe. And we then brought them together on a joint project to see if they can both get access to markets, new technology, and share their talent pool. We then came up with our project. Today we're showing our first project from Kenya. It is dealing with maternal healthcare with Dr. Jemima, who will try and talk to us about how just a tweet changed during the times of COVID to assist mothers to get access to hospital. And then she will also talk about how Kenya Healthcare Federation has assisted them to scale up to 5 counties. We will then move on to Dr. Christian Beck, who will talk about All Medical and the joint application and platform that's already in more than 10 countries and working around in Europe, and explain to us how this together they can help digitize a referral and consultation process for emergency situations. Thank you. On to you, Dr. Jemima.
Hi, thank you so much, Melanie and Ian. That was amazing. My name is Dr. Jemima Kariuki. I'm a resident in obstetrics and gynecology, and I'm also the innovator and founder of Wheels for Life. Wheels for Life is a program, as you've heard, that started from a tweet because of the rise of maternal morbidity and mortality that we had noted during the beginning, or rather the onset of COVID pandemic. So initially we started with just Nairobi counties with the help of KHF, AMREF, Telesky, Bolt and Rescue, but we've been able to actually scale up to 5 additional counties, which we're very grateful for. And it's a project that's been ongoing for the last 5 months now. And it's something that we're excited to work with so that you can see what we've worked with Tuungane to bring about. So thank you. Christian?
Thank you, Jemima. My name is Christian Beck. I work for ALM. It stands for All Medical. We are a technology development company focusing in time-sensitive interventions. So anything from stroke, heart attack, organ transplant, and including now pregnancy-related complications. And as we have discovered, there are a lot of similarities in the timescales involved. So for us to be able to partner with Wheels for Life and leverage the technology called Join, we would like to demonstrate that we're able to achieve specific social impact and milestones in Africa. So I welcome the opportunity to continue working together, and I'm thankful for the opportunity to be here. Thank you.
Thank you very much, Christian, and that's really a pleasure for us to have you on board. We want to, of course, present your progress and what you've managed to achieve for the past months to our panel of speakers. As we have published today, we have the pleasure to welcome Dr. Anastasia Nyalita, CEO of the Kenya Healthcare Federation. Welcome, Dr. Anastasia. We are very happy to have you here.
Thank you, Melanie.
We have also Mr. Henry Kilonzo, Manager and Senior Officer at Safaricom Foundation, responsible for the Safaricom Foundation and the M-Pesa Foundation. Thank you very much, Henry. This is a pleasure to have you on board. And finally, we have Mr. Peter Ndwati, also Group CEO of Resolution Insurance. We are very happy and delighted to have you as an investor and expert in that panel. Thank you very much, Peter. And now, without further ado, it is time to discover your project. So, Christian and Jemima, this is your turn to present your pitch. You will have up to 15 minutes to present it to the panel of speakers, and then you will receive feedback from first Dr. Anastasia Nyalita, and then Henry and Peter.
Thank you. And could you enable screen sharing? Please.
Yes. Normally this should be fine now.
Okay, great.
Perfect.
Second. Are you able to see my screen?
Absolutely.
Okay.
Thank you. So as my colleague Jemima mentioned, one of the unfortunate effects of COVID was that there are still emergencies, particularly pregnancy-related emergencies and complications that occur. Yet it doesn't mean that we're not able to provide services. So how do we mitigate that? So Join, which is developed by ALM, came together with Wheels for Life, which is a project supported by Kenya Health Federation, came together to form a partnership and develop what's called Okoa Maisha, which I learned that it means saving lives. And this project is a way to digitize an emergency referral system and consultancy for services through telemedicine. So we're here today to talk to you about pregnancy-related deaths and complications. What typically has happened over the past couple of years is that there have been improvements in maternal morbidity. As you can see, there's significant statistics that show that women die daily from preventable complications. Out of these 810 deaths, 94% are due to pregnancy complications. And several of those complications are due to COVID. And as you can see in our system, 51% of those complications are due to lack of transport and issues around logistics. So COVID has actually increased maternal morbidity, which causes delay in access to services. What we are proposing today is a mechanism that brings together the technology developed by ALM, which is called Join, and the program that has already been established by Kenya Health Federation and partners called Wheels for Life. So Join was developed as a technology in collaboration with several partners, including Philips, Siemens, and so on. And Wheels for Life, which is a collaboration that provides consultation services, is a partnership between partners including Bolt, Kenya Health Federation, UK8, Pharma Access. Together, we have formed what's called Okoa Maisha, which is bringing life and provide access to care and services to mothers during the time of COVID. Join is then integrated with the consultation service that's been developed by Wheels for Life. And its target is to provide faster diagnosis and consultation to patients during COVID. We will then leverage this service to be able to provide remuneration to our consultants that are then responsible for providing these services. ALM has already been in existence for over 10 years, and with its global presence, it's been able to achieve significant milestones. We've been able to see significant growth in revenue. It has employees all over the world, from Asia, Latin America, Europe, Middle East and Africa, and the Americas. And it has global clients from hospital systems to corporate clients. And this number is higher than 500 at this. Jamila?
So Wheels for Life has been able to do quite a bit in the last 5 months of operation, through the help of all these partners, especially with the upscale to encompass the other 5 counties. Wheels for Life has actually sieved through 32,524 calls, which have been mainly inquiries to make sure that everything is going all right. We have been able to serve 1,693 mothers who've been assisted directly by doctors, either for antenatal or postnatal issues. We've had 620 cab dispatches and 332 ambulances, which is the last thing down there. So we've been able to actually really help women, something that we're very proud of. And it's because of this that we want to actually show that we can do more and do better, thanks to all the partners that we seek to gain and that we already have. So the process that's been ongoing, next slide. The process that's been ongoing currently is that we'll have calls from the call center given to us by KEPSA and Telesky, and these particular calls will be able to dispatch. They'll be able to dispatch from the call center to the doctor directly, and then the doctor would log on to and actually WhatsApp to make sure that everything is held well, and then be able to communicate with ambulances. So this particular model that we're trying to create, which is Okoa Maisha, is able to now help bring the disjointed bits into one consolidated platform. And as you can see from the demonstration, at the call center, the patient will be logged onto the system such that the doctor on call will actually know that there's a patient incoming as a notification. From there, they're able to actually still receive the call and listen to the patient and give consultation as required. One of the things that is important is that we have timestamps which help us in trying to find out how the case is going. The doctor is able to then log on details with this and dispatch directly from the Okoa Maisha application to the rescue, or rather to the ambulance service that we have. And this enables that we can follow up the patient and track them from beat to beat. And even if we dispatch a cab, we're also able to track them so that we know how to log on to this particular patient. This enables us to track them even after delivery, to know how they're ongoing. And if at all it was a miscarriage or an ectopic, we can still find out if they're doing well. This ensures continuity of health practices, and therefore we're able to do better for our mothers and give them a more consolidated effort. Chris? Kristen?
Thank you, Jamila. Based on our strong foundation and can you hear me?
Yes, we can.
Yes, so based on our strong foundation and fundamentals, we believe that we're best positioned to deliver a sustainable business that provides access to quality care and helps save lives. This can be done because we're able to implement a per consultation model that improves remuneration for our consulting clinician, thereby providing with a means of living to sustain this business. To date so far, these consultants are providing this service on a volunteer basis. So we would like to provide them with a remuneration that enables them to be able to have continuity of care. We then are able to leverage an affordable pricing system that is inclusive to all population in Kenya, and will give us access to low income, middle income, and high income clients. On average, we are targeting €5, about 550 shillings per consultation. And from there, we're able to upscale this business to high margin clients, which could include corporate clients and potential partners. In addition, we will leverage the technology knowledge and know-how of ALM to be able to focus on developing and sustaining further products, which would then target corporate clients, including potential partners like insurance companies, pharmaceutical companies, or telcos. And in addition, we would also leverage the data that's collected from our interventions to be able to then build automated systems that enable faster diagnosis and clinical decision support. From there, it would enable us to provide a highly predictable income that's of high margin. And finally, we would leverage the data collected to spur further innovation, which would then support policy development, especially around data privacy and digital health in Kenya and the rest of sub-Saharan Africa. Then follow additional, in order to share this knowledge with potential partners for learning and scalability. We're also targeting partnerships with other supply chain partners that are interested in vertical integration, which will then enable us to come up with additional mechanisms to provide a sustainable system for our business. We know that as a young business, we're not going to be able to generate a profitable operation from the onset, and so we expect to be loss-making in the first year. But from year 2, with a business that we plan on and validating with our partners, we believe that we can achieve some profitability, and by year 3 achieve the numbers displayed here. So we're here raising capital to finalize our core product and be able to start the initial integration with partners. From there, we plan to enhance our product and then be able to scale it up through partnerships. And finally, after having tested and solidified our processes, we anticipate being able to automate the deployment of these processes and further scale that so that we can be ready for international expansion. While we're targeting innovation and being able to sustain our business, our core focus is to be able to ensuring that we're achieving and solving local needs. So for that, we're targeting reducing maternal morbidity by 10%. We hope to reduce referral speed time by 30%. Here, we're focusing on establishing through our telemedicine solution and the technology behind Join, we would like to connect obstetricians and gynecologists to rural nurses that are responsible for the referral of mothers. We then plan to achieve scalability by integrating our system with payment mechanisms like M-Pesa or the NIHF that is responsible for coverage of patients. And finally, we would collect and consolidate that data to be able to inform on patient outcomes and track diseases. We're a team of young entrepreneurs looking to solve local challenges, but together we hope that you can join us on this amazing journey. Thank you.
Perfect, Christian and Jemima. Thank you very much. We were sharp on time, 12 minutes. So now I will give the time for our speakers to express a little bit what they thought about the project, give a constructive feedback about what they think is going to make what impact they think this project can make into the sector, and of course tell us more also about what they are themselves doing through their companies in the healthcare sector in Kenya. Dr. Anastasia Nyalita, we wanted to start with you. As the CEO of the Kenya Healthcare Federation, you have supported tremendously the project Wheels for Life, and you are yourself very involved in putting together the stakeholders of the country to improve healthcare services in Kenya. So we would like to give you some time to tell us more about what you think about Wheels for Life, how you think the impact is made and how important it is for the country. And of course, tell us more about the Kenya Healthcare Federation and its action.
Okay, thank you, Melanie, and good evening, everybody. So my name is Dr. Anastasia. I'm the Chief Executive Officer of Kenya Healthcare Federation. We have walked this journey with, Dr. Jemima, at the conceptual stage when it was just, one of our directors met with her, and she thought it was a brilliant idea, which can, KHF can support. And just to let you know about KHF, we are the Kenya Healthcare Federation, so it's private sector for health. So the voice of the private sector for health. We are the health sector board of the Kenya Private Sector Alliance. In Kenya, private sector is very well structured, and that helps in engagement and advocacy and policy. And within the Kenya Private Sector Alliance, we have a sector board, which basically mirror the government agencies. So those act as platforms for engaging the public sector, the government agencies on matters that relate to private sector. So for us as Kenya Healthcare Federation, that is our role. We have been able to bring on board the other partners because some of them are members of Kenya Healthcare Federation. Some of them is the impact that they created at the beginning. We see this as a very, a very impactful innovation. So that's why we are fully engaged, because of course, in terms of reducing maternal mortality and neonatal deaths and so on and so forth. So where we're coming in now, going forward, now we've done the journey. So going forward, one of the things we are doing is that we've already started engaging NHIF as part of our advocacy to ensure that, from the community to the hospital, that reimbursement is also happening in terms of public sector healthcare financing reimbursement. Of course, I know we have my colleague who is in the private sector medical insurance, and those are also they're also members of Kenya Healthcare Federation, and we're also looking to really discuss with them, and I'm looking forward to hear what, from a private sector payer perspective, how we can support this initiative to grow it to scale. Now, in terms of also how we're structured, I see that, of course, you're looking at moving beyond the boundaries of Kenya, and I can tell you that Kenya Healthcare Federation has membership within East African Healthcare Federation. As Kenya and myself, we're very actively involved in the East African Healthcare advocacy, so we will be able to support you in that aspect, and also at the African continental level through the Africa Healthcare Federation. So in terms of policy advocacy, that is our role, engaging the government, shaping policy. This is where we see bringing partners together to really support such a noble initiative. So thank you for that.
Thank you very much, Dr. Nyalita. That was very insightful, and this is always important to have the vision and the opinion of a key sector actor like the Kenya Healthcare Federation, and understand how you are trying to support the sector. I'm sorry, I'm having a technical difficulty on my hand. But now it's time to also keep it to the investors that joined us, and Henry Kilonzo and Peter Andreatti, who will give us more of a feedback, an investor feedback on the project, and tell us also their action and how they are involved in supporting maternal health in Kenya. Maybe I will start with you, Henry, if you don't mind. Could you please provide to Jemima and Christian your feedback on their project and tell us more about how Safaricom and Safaricom Foundation are involved in that sector.
Thank you very much, Jemima and Christian. Before I give my feedback, you'll allow me to briefly just talk about what we are doing as Safaricom Foundation in the field of maternal, newborn, and child health. I had shared a 2-minute video with Ian. I don't know whether this is the right time to play that so that I do not speak and then a video plays to repeat what I was to say. If it's not possible, I can still talk about what we are doing as Safaricom Foundation on MNCH.
No, I'm happy to play it. We have the video. We can start with to play it. No problem.
Thank you. There is no sound from my side. There is no sound. No sound.
100,000 live. I strongly believe that no woman deserves to die while giving life. Maternal health for me is not just a pillar that I am passionate about. It has become a life mission. Even though the national maternal mortality ratio has declined substantially to 362 per 100,000 live births, this ratio remains unacceptably high, especially in the light of the global target of reducing the ratio to 70 per 100,000 live births. In addition, the staggering disparities between counties remain, with close to 99% of maternal deaths in the country occurring in just 15 counties. The government and its development partners have made substantial investments to address the high rates of maternal mortality in these counties. We as the Safaricom Foundation have chosen to focus our integrated program on maternal and child health in Lamu as a start, with the aim of scaling up to other counties in the future. Our goal is to improve the quality and access to maternal and child health services through infrastructure improvement, the provision of community-based outreach services, strengthening the referral system, especially for the remote areas of our country, training of health workers, and improving efficiency of operations within our health facilities. With these interventions, we remain optimistic that together with our partners, we can ensure that mothers survive childbirth and that children have a safe and healthy start to life.
Thank you very much, Henry, for this introduction. That's indeed very helpful to see and understand how Safaricom is very, very involved in the topic. I will give you now some time to maybe talk more about what you thought about the project.
Right. Thank you very much. Please confirm that you can hear me.
We can hear you. We just can't see you. We don't have the video, but we can hear you.
I think because of connectivity, let me try. Because I'm not muted. I've not muted my video. But let me continue. I think it's because of the connectivity. So thank you very much. You've seen Madam Rita, who is a champion from a trustee perspective on maternal and child health. Safaricom Foundation, we were established in the year 2003, and we are in the 47 counties. We focus on health, economic empowerment, and education. Specifically for this presentation, on maternal and child health, we do both strategic programs and philanthropic programs. Philanthropic, where we build maternities, we build newborn units, maternal independence units, among others. But for the strategic programs, now which is relevant to this conversation, is where we developed a maternal and child health program that focuses on what we call the 3D, the delay to seek care, delay to reach care, and delay to access care. And we've integrated advocacy to ensure sustainability. And we've also integrated technology to ensure efficiency, to ensure monitoring, and also scale. The program that Trustee Rita has talked about, we've been able to scale that from Lamu to now Baringo County. Lamu, we know, has in 2-3 years ago had 676 per 100,000 live births. That's what the maternal mortality rate. The technology that we use, we call it Total Health, that looks at registering mothers at household level, providing information on nutrition and pregnancies through text messaging twice a week, and also using the same to monitor the performance of community health workers. We are also exploring now linking that to the national level so that the data that we collect on the ground is able to feed into the national decision making mechanism. Now, I'm glad that Jemima and Christian, I heard about this platform sometimes back because some of the partners that you are currently working with from Access Foundation are the ones that are also implementing our maternal, newborn, and child health program in Lamu. We've worked well with AMREF and other partners, and we as Safaricom Foundation, as we've been very in the forefront in the response to COVID, having committed several hundreds of millions to that. So this comes in at the right time, because we know when we had the lockdown, we saw how pregnant mothers could not get to health facilities. Not just pregnant mothers, but also most Kenyans could not get to health facilities. For some of us who may have attended a clinic, you will bear me witness that you may have received a text message from a doctor or a hospital that you went reminding you that we are still open. That tells you the patient numbers went down. The 3 Ds, one of the Ds that we are addressing is the delay to reach care. And this is now where the Okoa Maisha comes in. I believe from a Safaricom perspective, because we are a telco company, we look at opportunities to leverage technology to improve care. And that's the reason I've talked about the platform that we are doing. With this, I see you came on board to really address a need where mothers are not able to reach care. I'm seeing also you integrating now telemedicine, where you're providing consultation to the mothers to ensure that they're getting expert care. Very good. Ultimately, I believe that you will be, or you are already addressing a gap, an existing gap, because we know mothers develop other conditions, for example, fistula, because they take too long to reach care. Others lose lives. Babies also develop, complications because of delays in delivery. So you come in to do the right thing, I can say also at the right time. Allow me to ask a question now based on the situation on the ground. One, we know the geographical challenges, also the road infrastructure in this country. How do you now address this? Because you may have the platform, but you may not have the right, there may not be the right transportation in a particular area. Have you been able to map out, for example, in Baringo, where I was a week ago, it may take, for example, a mother more than 3 hours to get from a place called Chemolikot to Cabranet, where they can access, let's say, CS services. I don't know how the app is there, the platform is there, but how do you address this? Are you partnering with other people on the ground to ensure that the right transport infrastructure is on the ground? Two, operating in isolation. Referral is one thing, but we also have the ability or the need to seek care. And we also have now the access to care. How are you, bridging how are you bridging the three so that there is awareness of the need to seek care? Then you come in to provide that referral or the transport. And then now, how do you ensure there is the right provision of the services so that you are not operating in isolation? Those are my first two comments, which will lead me to understand that this is not a standalone platform or program, but it looks at integrating to ensure end-to-end approach, which is critical for healthcare. Thank you.
Jemima, you are on mute.
Sorry about that. Thank you so much, Mr. Henry Kilonzo, for everything that you've said, and it's been an amazing time experiencing everything that Safaricom Foundation has been doing, and I'm really glad to be part of this forum. What we have done as Wheels for Life, and thanks to our partners KHF, AMREF, and the rest, is that before we enter into any particular county, or we actually start from the county government. So what we do is that we start by getting the county government buy-in. And so far, we've had very great support from the NMS, from the Ministry of Health, which means that they already know and are aware that we're actually on the ground working. And what they do is that they give us someone in that particular county who can be our response person, so that if at all there's a problem, for example, with let me take an example of Nairobi. If there's a problem of a strike, we are well aware ahead of time that this particular facility is not working, and therefore we're able to dispatch to another facility. The other thing that we have seen is that in the counties where we have issues, for example, with transport due to the road infrastructure, what we do is that we have a very good partnership with a company such as Rescue. So what happens is that they have ambulances on board in the counties themselves. So the hospitals around have onboarded the ambulances into the Rescue forum. And therefore, whenever we need an ambulance, the closest to the patient is the one that is picked. And in terms of where we are unable to actually get that vehicle to the patient, we talk to the patient through the process, as we actually use either the local taxi available, the local, sometimes even the local bike available, because we got a case, for example, in West Pokot where we couldn't get a vehicle, but we were able to use a bike up to the point where the road was usable and then proceed with the ambulance. So we do have a lot of communication with the local counties, because we are aware that we do not know all the facilities. The other thing is that before we also enter, we're given a list of all the facilities and are enabled to know this particular one is a level 3, level 4, level 5, and even the level 6, so that we know if this particular case is unable to be solved at a level 3, we can transfer up to a level 4. When it comes to the fast delay, what happens is that we actually promote that our patients call at any time with any consultation question, so that if at all it's an antenatal question, during the conversation, we'll tell them about the need for antenatal clinic. We'll send them for their clinics. We'll actually inquire, have you started your clinic? Are you on your supplements? Are you feeding well? Issues to do with nutrition. So that by the time we're getting them now for delivery, it's someone that is wholesome. But we don't want to cut out the ones that have not started with us during the antenatal period. We actually want them at that point. If we meet them at delivery, fine. If we meet them at the postnatal point, because some of them call with postnatal sepsis, for example, they had a delivery at home, they're now having infections or a fistula or whatever. So we're able to connect them to the right facilities. Therefore, we have an end-to-end kind of communication, so that we don't lose our patients at any point. Thank you.
Thank you very much, Jemima, for this very comprehensive answer. Henry, does it answer well your questions? And you're on mute, sorry.
It does. I love the approach where there is a lot of collaboration with the county. There is the mapping of the facilities. That means now you contextualize each county. She's talked about, Dr. Jemima has talked about the use of even bikes to ensure that patients get to the nearest passable roads. I think that's a good one. Okay. The other question is, how do you make money? I've seen the financials, but I'm looking at you charge around 500 Kenya shillings or 550. Is that sustainable? Or are there plans, for example, to get this to a level where this can be graduated to enable you make money for sustainability? Thank you.
So Christian or Jemima, I don't know who is the one who wants to take that question.
I can speak on the next.
Yes, Christian, please go fast.
So currently this is a volunteer service. I believe that what happens at this point in time is that there are services that are offered free of charge, but our plan is to charge a minimal amount per consultation. So every time a doctor receives a phone call and provides advice, we will charge the 500 shillings. And our hope is that by increasing the number of consultation and minimizing cost, we would be able to achieve profitability. So that's one level. The second level is that we want to leverage the data that's collected as a way to spur additional services. And this would be by partnering with telcos like yourself, or partnering with pharmaceutical companies or insurance companies. We would be able to achieve sustainability. And the third revenue for us is by going into a higher margin business. And that's where we would charge a subscription, which is a higher fee. And here we're planning on providing access to our clinical team so that anyone can have quality feedback. Those are the three models that we plan on adopting.
Perfect. Thank you very much, Christian. I would like, just for the sake of time, I would like to give also the possibility of Peter directly to give a feedback. But Henry, if there is any other questions you have, I will get back to you at the end, if that's all right. Thank you very much, Peter. As the Group CEO of Resolution Insurance, we will be very happy to know what you thought about the project Wheels for Life and All Medical, Okoa Maisha, and what also Resolution Insurance is doing in this sector for pregnant women.
All right. So, thank you very much. I'll listen in keenly, and my approach to this conversation was two-pronged. One, as an angel investor, so I'll ask questions about revenue models and return at the end. And then, but the first part is coming from the payer side. I was a bit confused whether this model is a complementer to the already existing network. What we do as a Resolution Group, by the way, we are the third largest healthcare funder in East Africa, Kenya, Uganda, Tanzania, and Rwanda. And what we offer to our clients is a model where there are about 1,750 providers in the region that you can plug into to access services. And 4 years ago, we went into the public space. So 23 of the 47 counties in Kenya are actually insured by us. And we offer a comprehensive service that includes maternal healthcare, from conception to delivery, and of course neonatal after the child is born. Now, so when I was listening, I was wondering, so let's pick a remote county. We insure Sebaringo County. If our patient, we have a lady who is on our panel, who's insured by us and requires services, we actually go and negotiate with the closest provider to them. Are you complementing that particular area? Are you complementing that that gynecologist in that particular area? Or are you offering last mile? Are you offering the golden hour where that patient can get to hospital first? Insurance companies like ourselves have already invested in telemedicine. So we have a call center where we receive the same kind of calls, and our doctors are able to advise. We're able to dispatch ambulances through our network. So I need to understand that part and how you intend to work with the insurance companies. The second issue is if the consultant is already charging the payer, ourselves, NHIF, a consultation fee, does your cost come up and above that? And for that reason, are you increasing our costs? Because you understand insurance companies make money by controlling costs, by making sure that there's quality access. That means there's no repeat visits. And that the patient get the right treatment the first time and the cost is as low as possible. So I just need to understand whether you're complementing the consultants that we currently work with or you are a competitor to them. Now, that was a part of a payer. Now I'm asking, but the next question is, as an angel investor, I've invested in the healthcare space, not just in on the insurance side, but in the emergency services side, in diagnostics, in primary healthcare. And of course, as an investor, I'm looking for the quickest return. I'm not an impact investor, so impact I leave to impact funders. I look for the quickest return, and so scale is key in that kind of space. Now, I didn't understand your revenue model, and when I looked at your slides, year one, I think there was an error. If you look at your revenue vis-a-vis your expense, although you're not making money on year one, I think that number is too big. The second issue is, because I didn't understand your revenue model, I'm struggling on how and on the return on the investment. Finally, I didn't get your ask. What are you asking investors to invest in, really, in scaling? Because you already have many partners, and all these partners sounds to be impact people who are actually not seeking a return. The people who are focusing on improvement of quality of care, improvement in lowering maternal death. So as a private investor, what is your ask and what is the return?
Jemima, Christian, thank you very much, Peter. That was very comprehensive feedback. I will give the opportunity for Christian and Jemima to respond. Take your time.
Yes, please. Thank you, Peter. I really appreciate the questions, and we're really here to see how we can partner. So first, going to the payer side, we see ourselves as complementers. What we would like to offer is a service that could, I would say, triage any potential complications. So if a mother is calling and it's not a severe enough question, our consulting service would minimize or would reduce the likelihood that the mother needs to be transferred to the hospital. So this would be less cost for you, instead of having the mother go to the hospital, then assess and found that it was something that could have been mitigated from a local community hospital. So we're sort of like a stopgap to help triage severe and non-severe cases. And in those instances where it's severe enough, then we refer them for treatment. So then we're able to then work with you as a way to reduce those costs of admission. So that's the first part that we are targeting as more of a complement to help you lower that cost. Regarding the question about whether consultants are going to be receiving fees in addition to what they're currently charging. So as of now, they're not charging to provide this service. So it's free of charge. And what we plan on working on is a model that's lower than what is currently charged at the standard. So we would be between 0 and, let's say, 2,000 or 3,000 shillings. My understanding is that a consultation fee is around 3,000 to 4,000. So our service is a way to just complement at a lower enough cost, because these consultants are also working on a different time schedule. So this provides them with additional revenue. So we would like to work with you to come up with a reasonable remuneration system that is affordable for both you and the patient and provides an additional revenue for the consultants. So speaking to the investment side, as you saw, the initial upfront cost is around infrastructure. So setting up the infrastructure, as we discussed earlier, how do you connect the different partners that are involved in referring patients? So from transport to the providers to communication, you have to set up that infrastructure because you want to have a seamless experience so that you don't lose patients along the way. So the initial upfront cost is going to be what needs to be overcome. And then over time, our costs are reduced because we've already put in that one-time cost ahead of in the initial phase. So we have a loss-making business at the beginning. We're raising 4 million euros, and that gives us about 18 months runway to be able to get to profitability. So our model is a per consultation fee, and then we would add some additional revenue lines. So the initial model of per consultation is that every time a mother calls, we check their payment system, whether they pay cash or they're going to pay through insurance. Then we validate that. We secure the payment from their side. So that goes to the consultant, and that data is all tracked. The second line of revenue is that we would like to offer a subscription model, which is going to be a premier service that we would charge. So those are the two main levels. And then we have a partnership model where we work with pharmaceutical companies or insurance companies where we can offer packages to their corporate clients. So for example, if a company has 500 employees and would like to offer a service to their employees, we would provide the service at a lower cost than them having to go to the hospital for regular checkups. So those are, I would say, the initial concepts that we're putting in place.
Thank you very much, Christian. And I guess this is also how All Medical, in any case, has monetized so far the services.
That's correct. And we have employed a dual strategy where we have partners that provide us a fee that enable us to be able to recuperate the infrastructure costs that we have to deploy our technology upfront. And then we are also charging a per consultation fee to the providers.
Thank you, because that's helpful for also our panel and our audience to understand that this is a model that has been used in other countries and other jurisdictions, and that you're trying to employ also in Kenya through Wheels for Life. Jemima, did you want to add something?
Yes, I wanted to say that, for example, we find that pregnancy is one of those cases where you never know where the delivery will occur. And I've had Mr. Peter talking about having 23 county coverage and with about 1,700 providers. So in the case or event where the woman is not in the jurisdiction of the 23 counties, but is, for example, insured by resolution, it means that this lady, if they do connect to Wheels for Life, they will get the same, they will actually be able to get to hospital and be offered the best service at that, let's call it that red zone, where we need them to get to the facility and be provided care immediately. The other thing is that the doctors that we've onboarded are actually residents in obstetrics and gynecology, which means that they are actually, they have a lot of expertise when it comes to maternal health. Therefore, when we triage and we tell a patient, because most of the cases that go to hospitals that are obs-gyn related, if they're gynecological in nature, they end up being issues to do with BV, that's bacterial vaginosis, infections of that nature, things that can be easily treated if someone knows what to pick out without having been there presently, which means that we offer, having the doctors onboarded that are specialists in that area, they offer the same level of care without actually having to go to the facility, which means that if your consultants offer, let's say that rate that we're talking about, 3,000 to 4,000 Kenya shilling, then that's a rate that you don't have to pay, so that the patient goes in for other cases, for example, myomectomies or fibroid removal, ETCs, which now may require to have that physical meeting with a particular doctor. So we see ourselves as incorporating into whatever the insurance is offering, so that you don't lose out on many hospital visits that could have been easily sorted out through telemedicine. Yes, so that's what I just wanted to add to what Kristen has said.
Thank you very much, Jemima. Peter, I hope that this answered your first questions. I'm sure you have many more, because there's many more that needs to be digged into. We had an hour for the panel, for the audience. So I would like to now take it offline with you and Henry and Dr. Anastasia and Nyalita. But already for what you've also presented to the public that is watching us, and thank you again for everyone who had the time to come today and join us for this first event. You provided very high quality feedback that is very important for everyone to understand first how we invest in a social impact company in Kenya, whether you're a social impact investor or an angel investor. And second, what are the challenges that change makers and very motivated and inspiring entrepreneurs are trying to solve at the moment in the times of COVID, which are challenging for everyone. So I would like to, before we close the live and thank our public, I would like to give a few words for Ian Minjiri to close it. Thank you, Ian.
Thank you very much, Melanie. I think it's a great honor to be around these experts and panelists, just to hear, like, you know, straight from them what it is that they would expect from entrepreneurs, and also to see our entrepreneurs take up this task and come up, because the program has been dealing with early stage entrepreneurs, because, you know, we want to build smaller businesses, we want to inspire people to start it up. And through the Tuungane Program, they went through, you know, a legal curriculum with Africa Law Partners. We went with technology curriculum with our Apollo Creatives. We went through the marketing program through our partners, Bakery Berlin, and of course, financial management through Melanie, and project management through myself. So I'm really happy to see them build and get at this stage to be able to, you know, come here and sort of be in the Shark Tank. And thank you so much, all of you, our viewers, for coming on board. For those that are watching, I hope you've been inspired, you know, to not wait for change, but to be the change that you want to see in Africa. And also, as I speak to our investors, I know, you know, the best innovations come from providing solutions to problems. Here on Tuungane, we're trying to show, you know, in Africa, we have the problems, but we also have the solutions. We just need you to come in, put the money with us, you know, and collaborate with us, work with us, let's unite. So Tuungane. Santi sana, and thank you very much for everyone that has come on board and for our viewers. And please follow up on the rest of our shows, and I will give it back to Melanie for the last word as we move to the offline session. Thank you.
Thank you very much, Ian. And I just finished by thanking all our partners who came on board and supported Tuungane since the beginning. The European Business Angel Network, Shaper Impact Capital, an initiative from the Global Shapers of the World Economic Forum, direct partners, JAMA Funding, but of course also Green Tech Capital Foundation and our experts that supported the program and came along with us, Apollo Creative, Africa Law Partners, the Bakery Berlin, without whom we couldn't have made this live and those events possible. Thank you very much, everyone, and thank you, the audience. We'll now stop the live and have you for the next episode, which will happen next Tuesday on sustainable transportation in Ghana.
Thank you. Bye-bye.
Thank you, bye.
Oh, did they leave?
I think they left.
Oh no.
You might want to touch base with them.
Okay. I think it was not clear.
Call Anastasia, call Peter.
Okay.
Yeah, imagine to look at